Memorial Hermann is an integrated healthcare system with both inpatient, outpatient, and physician facilities. We currently account for about 26% of all the inpatient admissions in the greater Houston area. Memorial Hermann has a series of goals and priorities, but at the very top is to ensure quality and safety for all of our patients. After that, we want to ensure an excellent healthcare experience for the patient.
Cerner's a healthcare information technology company, actually celebrating our 30th anniversary this year. We spend quite a bit of time really working with the nurses to understand the types of things that they're trying to do at the bedside, working with them to understand, how changes in regulation affect the way that they do their work on a day-to-day basis.
Patient safety and having the right information at the right time is a huge significant area that we're trying to address with our solutions. As clinicians provide care, if they don't have the right information at the point they need it, they might not make the right decisions in correlation to that patient's care.
Memorial Hermann's primary concerns were relative to patient safety and the dispensing of medication at the patient's bedside. Their project, termed MedSafe, really focused on the proper labeling of medications and then the proper dispensing of those medications at the patient's bedside. So Honeywell's role, along with Cerner's role from a software perspective, enabled Memorial Hermann to achieve their goals within that MedSafe project by, again, scanning the label, the barcoded label at the patient's bedside that's on the medication, and then the computer system, the Cerner software system, alerting that nurse or caregiver that that's the right medication for that particular patient.
MedSafe is our terminology here at Memorial Hermann for the whole closed-loop medication process with that from beginning to end. At every occurrence, we have checks and balances at every single step to make sure that the right med are to the right patient at the right time.
The weak link with the order entry systems of the past has been the actual administration of the med at the bedside. Because although we may have nurses and pharmacists and technicians looking after the order as it's entered by a physician, at the bedside, there's just the nurse delivering the medication to the patient. And so the opportunity for error in many cases is greater at the bedside than it was on the order entry part.
What can we add on that allows us to really push through a MedSafe project? That capability that Honeywell brought to Memorial Hermann was an advanced scanner that can read the plethora, the breadth of all of the symbologies that are out there.
Honeywell has helped us turn our standard very long barcodes into Aztec barcodes. What that does is it brought to light and facilitated an ease of process for nursing. With the Aztec technology, I can put several Aztecs on an armband and there's no nursing struggling to get the barcode scanning correct.
Honeywell's technology is important to the healthcare vertical as hospitals are looking to implement barcode solutions at the patient's bedside. We call that the point of care. And there's three primary objectives that hospitals are wanting to achieve. They want to positively ID the patient, they want to deliver the right medication to that particular patient, and they want to draw samples, specimens from that patient and properly label them at the time of collection. So Honeywell's technology, in conjunction with Cerner, our products being certified by the applications, deliver a seamless solution to the customer.
The nurses on their bedside computer stations have a barcode scanner, and they first scan the patient to make sure that's the right patient, and then they scan the medication, just like a scan in a grocery store. But what happens in the background is that the computer checks the patient and the med and that electronic record to make sure that everything matches up. If it doesn't match up, the computer beeps and puts a message on the screen that says this is not the right med or the right time or the right patient or the right something.
Our barcoding solutions help drive a new level of safety for nurses and for patients in the way they deliver care to the patients.
So the handheld device is a critical aspect to how we provide care at the point of care. That mobile device having information available on it without having to take in a full cart into the room really does help support the clinical process.
And what we're finding is that all the things that we didn't know before, we're uncovering. With MedSafe metrics, we now know every transaction on every patient administered, every medication, every day. The most interesting after effect of the launch is that patients' families have commented, wow, this is good. They also comment about, we were always wondering Since we have a common last name, how are you going to keep our meds separate from somebody else?
We leverage Honeywell technology to support our point-of-service processes for nursing, such as medication and specimen collection. So if I'm collecting a specimen, I can barcode the patient, barcode the specimen, and then capture the specimen I need and as a part of my documentation process.
We're currently using the Dolphin 9900 for Cerner Laboratory PathNet specimen collection. With this technology coupled with the Cerner application, they can simply walk in, scan the patient, the list of specimens that need to be collected appear on the handheld. They can collect the specimens, print the labels on a mobile printer that they have, label the specimens there, obviously facilitating a closed loop specimen collection, patient safety environment.
I think some of the things that Honeywell is doing now with their plastics that are designed specifically for healthcare and the ability for those devices to be cleaned in an appropriate manner is going to be a big advantage for Honeywell, just from the standpoint that infection control continues to be a hot topic within our organizations, and the ability to prevent the spread of hospital-acquired infections is not only going to result in better patient safety for hospitals down the road, but it's also going to help drive their bottom line, as some of the reforms will shape the way hospitals are paid on hospital-acquired infections.
The Honeywell product line, it comes with very solid technologies around its form. I can use up to an isopropanol 50% solution, which is a very high solution for cleaning. It comes durable and medically durable. I can't tell you the importance of durability of medical equipment.
We work every day with our nurses, our pharmacists, our physicians, our administrators to make our hospitals, number one, safe, and number two, effective in terms of the medical care that's delivered.
Our metrics allow us to know where we're succeeding and where we need to re-educate and redefine expectations. Partnership that we enjoy allowed Memorial Hermann to take the step for medicine.
It is all about partnership and relationship. I can buy a computer anywhere. I can't buy responsive customer service, technology and engineering resources that are there for me all the time. I'm just lucky to have come across it.
Well, Honeywell's focus within technology, within the healthcare vertical, and then our distinct focus on customer service and ensuring that we meet the needs of this healthcare vertical are really what differentiates Honeywell in terms of being a partner to both the software providers like Cerner, as well as to the end users like Memorial Hermann. We want to ensure that we meet those customer needs by understanding the unique requirements within the healthcare vertical, and then design and develop, engineer our products to meet those needs, ultimately achieving the goals of the healthcare system, which are improving outcomes for the patient as well as ensuring the safety of the patient.
Our work on the front end and our work with Honeywell on the front end helps to ensure a better outcome for the providers on the back end of the process.
By virtue of our computerization of the electronic chart, computerization of the electronic medication administration record, and our bedside barcoding of both the patient and the medication, we are working to not reduce medication errors, to eliminate medication errors. That's our goal.